exciting day, and it is an emotional day. And it's a wonderful reflection of the amount of work that so many people in public health and across different avenues of science have been spending all of their time and heart and energy on in this last year to result in this opportunity for most of us today, for many people today.
What is the state of our collective health in Washington as of now?
Well, the answer to that is that it depends on the experience that you've had individually. So a lot of folks in the, I would say 30 to 60 age range are doing a lot better right now. There's a sense of hope. There are more opportunities now. And as the weather gets better, I see that blue sky behind you, that's such a big boost for so many folks. So we are seeing rates of anxiety and depression go down for adults in Washington state right now, but we are still really concerned about the mental health and behavioral health experiences of young adults and youth and teenagers and kids. That is a group that we are concerned about. And then the other thing to consider is that there are lots of groups in our state who have experienced discrimination and social marginalization and economic insecurity, maybe food insecurity. And those folks are not feeling as optimistic right now, and maybe not as hopeful. And it's going to be a little bit of a longer road. What we're seeing now are communities and pockets where things are becoming more discrepant. There's bigger differences between groups. So you have some groups that are doing a lot better quickly, and you have other groups that are not doing better quickly. So there's more of a split in our communities. But some of the metrics in terms of overall rates of anxiety for adults in the state, they definitely are going down, as is depression. But like I said, there are pockets that we are still very concerned about. And substance use does tend to increase as the weather gets nicer and people are outside, maybe feeling more comfortable about gathering. And so substance use remains a concern for us.
The Seattle Public School District is welcoming middle and high school students back to a degree beginning next week. And you mentioned a serious concern for the mental health of, our young folks.
Well, I mean, I think that the need for in-classroom or back to classroom education is reflected in the experience of so many kids and so many teenagers that have been really isolated and had some pretty significant mental health symptoms as a result of that. So strictly from a behavioral health perspective, we really want to advocate that young adults and teenagers and kids and adolescents get the opportunity, as much as is safe based on public health guidelines, to interact with each other, to participate in things, and kind of get back to that socialization and those connections that are essential to resilience for them.
Yeah, you bring up an interesting point, right? Because I guess if I've been grounded for a week and I get back out, I'm going to go do it all 120%.
Yeah, it is definitely a risk, especially for teenagers and young adults moving into these hot and warm summer months. That risk taking is a bigger concern. And even amongst adults, becoming complacent, like, oh, I have my vaccine, now I can go do X, Y, and Z. And that's not necessarily true. So patience is definitely required on all of our parts, as is sort of continuing to monitor our decision making and our ability to regulate our impulse control and to make good decisions moving forward, because that's going to be the thing that really pulls us all together collectively into reconstruction and recovery.
So let me give you about a sense about where I'm at. I'm in Pierce County. This is Clover Park Technical College. This is where health department's got a massive vaccination site. You can hear cheering. You can see smiles everywhere. This is not a negative place. How does today kind of fit into the cycle?
I think it's really important because it gives a lot of people hope. Previously, there are a lot of individuals and families and communities that might not have had a lot of hope about where this pandemic was going and how the summer was going to feel. And being able to open up vaccinations and kind of celebrate the next phase of this recovery and how we're moving forward together is really a great experience for a lot of folks.
I'll just share something anecdotally from myself. I ended up getting a vaccine before I knew it, and it was overwhelming. And I wasn't really thinking that I was overly concerned about it, but once it happened, it was hard to deal with. What's going on up here?
Yeah, that's really interesting. Hard in what way? Like the hope was overwhelming, like that?
It's just like I got to a point where I wasn't prepared for that kind of emotional
Yeah.
response.
Yeah. Well,
And
I mean, I
I
think
can't
part
imagine I'm
of
the only one.
yeah, I agree. And I think part of the reason why there's so much excitement is a reflection of how hard the last year plus has been for a lot of folks. And it's caught up with us in ways that we might not even be aware of. I had a friend very recently say that when we experience a loss right now, it sort of is connected to a deep sense of loss that we all have based on this whole thing. And the opportunity to get a vaccine and to kind of move forward is in direct sort of opposition to that sense of loss. And it's exciting. It really is. And it is kind of overwhelming on a neurological level for some folks.
How are we supposed to go through this um, without feeling like our brains aren't going nuts, right?
Well, I mean, I think maybe that's part of it is that it's okay to feel a little nuts and it's normal. And a lot of us are having trouble sleeping and focusing and concentrating and just kind of cutting us all some slack. We owe it to ourselves and our kids and our families to recognize that, normal is all over the place right now. And there's lots of ups and downs, and not to hold ourselves to the expectation that we have to, have it all reined in and know what's going on at any given time. Just don't give up. One of the most amazing capabilities that humans have is our ability to persevere. And being patient is incredibly challenging right now, but we can persevere. And if we just hang in there with this, we will get out in front of it. And so, as hard and difficult as that is, particularly when it's nice weather, that really is what's needed. And it's not going to be forever. We will get through this.
And then at some point we'll make that turn, and everything that we've gone through and maybe lost will probably hit as well, right? There's still lots to go through right now.
Well, yeah, I mean the recovery process is not, it's not just a step, it's a process, right? You don't just jump to the next level. And there's going to be experiences of grief and loss about what we won't get back and what we've lost in terms of our relationships and some of our some of the aspects that affect people's family lives and economic lives for sure. But the realistic behavioral health perspective needs to include the element of hope, which is about understanding what the opportunities are that exist now and processing through and grieving the loss of things that we might not get back true, but also not over focusing on that and giving due attention to the possibilities and the opportunities that still remain.